I'm Ted Owens, and welcome to Mountain Health Today, a program of outreach and issues that are important to the community regarding healthcare. My guest today will be Harry Weiss from the Tahoe Forest Health System. We'll be back in just a moment. Welcome back to Mountain Health Today. I'm Ted Owens, your host, and my guest is Harry Weiss, Chief Executive Officer of the Tahoe Forest Health System. Harry, welcome. We've spent quite a bit of time together doing these programs, so it's good to see you again.
Thank you. I'm very happy to be here.
Well, today we're going to talk about a couple of things, primarily the challenges of healthcare delivery in a rural setting. This is a problem or a challenge for the majority of the United States, correct?
Absolutely.
And we're not immune to that here. But before we do that, I would like to share a few things and embarrass you a little bit. I understand you were recently recognized by Becker's Hospital Review as one of 60 critical access hospital CEOs to know. Congratulations.
Well, thank you. And my reaction to that is our great performance really only happens via a team effort. So I really receive that recognition on behalf of our whole team. But I think more importantly, that is our thank you back to our community for really striving to provide superb care to every resident in our community.
Well, and I appreciate that, but I think it's also important for folks to know that you were the only CEO of a critical access hospital in all of California, Arizona, and Nevada to be thus recognized. So it does take leadership, so I just wanted to give that back to you.
Thank you.
Let's talk a little bit about some other things that you're engaged in personally. You are recently appointed to the American Hospital Association Governance Committee. For the folks at home, what is a governance committee and what work do you do?
This particular governance committee within the AHA, the American Hospital Association, really looks at policies that are pre-existing across multiple states that are either helpful or harmful to especially rural or small hospitals. And it will also take a huge look at potential new policies that are coming down the road. And also it's an opportunity for us to propose potential new policies that haven't been thought of before as well. Because the small and rural hospitals are probably the most precarious or most at risk hospitals in America out of roughly 5,000 total hospitals in America.
You also serve on the council of the AHA section for small and rural hospitals. So those two dovetail very well together. You're able to represent the concerns and challenges financially maybe of rural hospitals in the governance setting.
Right. This focus is on just rural and small hospitals across our country, and so I started my healthcare career 40 years ago in a small hospital setting, and had small hospitals sprinkled all throughout my career, and Tahoe Forest is one of the most special, in my view, smaller health systems in California or in America, and so this area of focus and now the opportunity to serve with the American Hospital Association on an area of hospitals that are potentially more fragile than others is just a very great honor to hear feedback and to really provide a lot of forward-looking policy critique going forward.
Well, and I think that critique would be very important. Very often, I think, governments have a tendency, whether they're a state government or the federal government, to create regulation or policy that is a one-size-fits-all. Right. And very often, because of population distribution, it's very easy to fall into the habit of creating policy that really might be affordable or relevant in a very urban, metropolitan, high-populous environment. That's a fair statement.
Absolutely.
And so with your work with the AHA, and again, that's the American Hospital Association, those types of regulations or policies may not be feasible financially or even with resources such as staff to comply with. Is that also a fair assessment?
That is correct. There has to be a series of policies or framework or foundation, if you will, for many of the small and rural hospitals that has many different features than in urban settings, because quite honestly, many of the small or rural simply couldn't survive, based on settings that only work in an urban setting. And so my goal as I work as one of a greater team across our country is to really speak very transparently about what works or doesn't work, what's helpful or harmful, just in a very honest way, so that our elected officials in these various domains really are getting a straight scoop on what will really preserve great health care in all these rural settings. That is the end goal of our elected officials. We know that's the case, but due to significant lack of knowledge, many times there's historic policies or new policies that are being proposed which could add greater fragility to sustainability for smaller rural hospitals.
And that's kind of a polite way of saying that some policies may be so burdensome that could result in the closure of a hospital because they wouldn't be able to comply.
Right.
And that is a concern. I understand that the landmass of the country, 90% of the United States of America, has rural hospitals sprinkled all throughout it. How many rural hospitals, if you know, are there in America?
Just in the critical access category, there's more than 1,330 hospitals out of 5,000 in critical access. Then there's a great number of rurals. I don't recall the exact number of those that sit on top of the critical access rural hospitals in America.
Okay.
So it's a significant percentage of 5,000 hospitals
People
in America.
rely on those, without any doubt. And our area is a little bit different, and we'll talk a little bit more about that in our next follow-up segment about the Lake Tahoe area and the issues that we face here. You've been with us on Mountain Health Today. I'm Ted Owens. I've been speaking with Harry Weiss, the CEO of the Tahoe Forest Health System, and we're talking about the challenges of healthcare delivery in a rural environment. We'll be back in just a moment. Welcome back to Mountain Health Today. I'm talking with Harry Weiss about the challenges of rural health care in America. Harry, where we left off was a discussion of the majority hospitals, or many hospitals in the United States serving the majority of people in the rural environment face very different things than urban. Now, Tahoe Forest is located up in Truckee in the North Lake Tahoe area. We have Barton down in Barton Hospital in the South Lake area, similar in many regards.
Right.
We're in a rural environment, but we have a great deal of visitors due to tourism and what have you. It sets us a little bit apart, and Tahoe Forest and Barton have advantages that other hospitals don't have.
Right.
And I understand that, yet one of the problems is, for example, is recruitment. In a rural environment, very challenging to recruit physicians in today's world and environment. We have that issue. Other hospitals have that issue. Share with us some of your concerns about the future of recruitment to rurals.
Even though we have an amazing beauty and we have an amazing Four Seasons, and the fact that we're rural, all of those issues do contribute to difficulty in recruiting and in retaining physicians, because it does take, for physicians and other healthcare workers, a special kind of person that really enjoys all those attributes of winter, spring, summer, fall, etc. here. But as we look at rural hospitals, urbans typically have an advantage from their residency program. residency programs try to keep their great residents close to home, and so drawing, new healthcare workers or experienced healthcare workers out of urban markets is a real challenge for all rural hospitals in America. And as I visit hospital after hospital, it's very interesting the degree of difficulty it is for them to recruit physician personnel. We're looking by the year 2025 across all of America to have more than 80 to 90,000 physician shortages in America, and we believe that the shortages will be felt most acutely in our rural areas and other staff areas like registered nurses, lab scientists, pharmacists, and so forth. Just in the nursing category alone, by 2025, probably 800,000 to 1 million shortage there. And so we hear of just tremendous difficulty to recruit and retain nurses, for example, in many
And of course, that
rural settings.
in our particular area, we're a rural setting, but the housing crunch is a challenge as well.
Absolutely.
where we are.
The cost of living in many of these areas and or just the availability of housing is a huge issue.
And let's talk a little bit about the money side of things for rurals. Rural healthcare systems have very different payer mixes, different ratios of commercial insurance versus Medicaid or Medicare. Share with us a little bit about what you see in the rural world in that regard.
What happens with kind of the federal policy on Medicare or the state guidelines on Medicaid and then common insurance techniques, many rural communities have a significant number of either poor or elderly, and so there has to be very different policy guidelines, especially for Medicare for those rural facilities, if there's an abundance of either senior population or the poor there, because more than 90% of U.S. hospitals lose money on Medicare and Medicaid, and if a small or rural hospital is losing money of any significance on Medicare or Medicaid on its hospital operations or the physician side, that is a recipe for non-sustainability. Right. And so there has to be very special thought and policy guidelines there that provide a fair and thoughtful minimum reimbursement policy to keep.
Now your experience is a little bit different, isn't it? Because you have a tremendous amount of visitors, both in the winter and in the summer, and does that impact your payer mix, the kinds of insurance that you see?
It does. When we have the large surges, there typically is a surge of the commercially insured, and the percentage of Medicare and Medicaid does decline a little bit. But what we're really looking at, because it's not just about Tahoe Forest, we want to make sure that healthcare is really available at the physician level and at the hospital level in as many rural communities as possible. So what I really examine is are these hospitals breaking even on Medicare and Medicaid, or are they losing money? Because if they're losing money, a smaller rural hospital cannot loss shift or cost shift those losses to a significant enough degree to other commercial insurance like a large urban hospital could to stay afloat. And right. So it's just so critical to make sure from a policy perspective that they're experiencing at least a break-even status, and many are not at break-even. So we've got a lot of policy work to really understand what it's going to take in operational review so that these hospitals can break even on Medicare, Medicaid.
And when you say policy review, and I think in our next segment we'll probably get into it a little deeper, we'll talk a little bit about advocacy and the type of work to affect policy in ways that benefit rural areas, and I know that you're involved in that, as am I. But beyond advocacy, it's still a challenge for a rural healthcare system that doesn't have the ability to cost shift because they don't have the payer mix that enables them to do that. So they're really walking a very thin line operationally in terms of their budgets.
Absolutely, and as I visit town after town, their resources really vary widely, and the number of services therefore vary proportionally as well. And we are seeing a decline of service in many areas where maybe they were used to be able to do something in a particular service line a few years ago, and today they can't.
But you and I are going to talk a little bit about this, because you've taken some action in that regard in our own broader region that I want to share with our folks at home. You've been watching Mountain Health Today. I'm Ted Owens, your host, talking with Harry Weiss from the Tahoe Forest Health System about rural healthcare issues, and we'll be back in just a moment. And welcome back to Mountain Health Today. I'm Ted Owens. We're talking to Harry Weiss about rural healthcare delivery. Harry, we left off kind of on the issue of advocacy. Through your work with the AHA, the American Hospital Association, and our work with the Association of California Hospital Districts and District Hospital Leadership Foundation, advocacy is something that we actually have the ability to do on behalf of not only our interests, but rural interests in total, correct?
Very correct.
And we've spent some time in Washington, D.C. not too long ago, walking the halls of Congress, and I got to tell you, when you do that, you don't have a moment to spare. It is chock-a-block meetings, and you've got to make your points very clearly. Most rural hospitals don't have that opportunity, so thank you for taking the extra time to serve them with the AHA.
Thank you.
Let's talk a little bit about your work reaching out to other rural hospitals, because I think it's very fascinating, and I know that it's important to you. Not all hospitals have the same level of services.
Correct.
We're up here, we do certain things, and other hospitals do certain things. Share with me a little bit about your thoughts and some early implemented relationship building in that regard.
I think first, I hope our local residents really feel fortunate to have a great rural Tahoe Forest Health System here in the North Lake Tahoe region. That is a very rare and special rural health system that is very atypical with most rural communities. But our heart is really in the right place for residents of rural communities all over California and even outside of California. So as we begin dialogues with other communities or leadership of healthcare providers in other communities, it's a very important journey of how we can help understand what are their needs. Are there some collaboration things that we could potentially do to really help them serve their community better? And for example, in many rural hospitals, when you're open 24/7, you have all of this fixed cost, whether you have 1 patient, 5 patients, 15 patients, or 25 patients. So I think by engaging in conversations together, there may be win-win conversations on how the support services behind the scenes that support that clinical care maybe could be more efficient. And again, that's all done in a friendly, voluntary manner. And the needs might vary town to town and so forth. But
what you're talking about is filling gaps.
Absolutely.
Really. For example, we have a cancer center, and I know that we have a champion in Dr. Heifetz that believes in reaching out to other communities where we might be able to help, but keeping patients in their communities at their home hospital.
Right. And I think one parallel that's so special is we've had a relationship at Incline Village for 21 years now. That great hospital and its community closed 3 times in its first 10 years of operation. Now it's been open on a steady basis for the last 21 years, and what this has done is it's allowed us to clarify our thinking, clarify our strategies, and so as we go out and talk to other facilities out there, are there elements of that, because it's really been allowed to become a very efficient clinical operation. Mm-hmm. The overhead costs have been lower versus, per patient episode versus most rurals. And so this is an opportunity from an experience perspective as we listen to pain or challenge, could we help on a voluntary basis
So let me pick up on that just for a moment, because that model can spread to other rural hospitals that aren't in the system. Both distance and transportation are the biggest challenges for rural health systems. Now, telehealth or telemedicine can begin to really play a strong role in filling those gaps.
Absolutely.
Through those collaborative relationships. So what does the future of telehealth look like in that respect?
I think that telemedicine or telehealth will really grow in many modalities, especially in certain specialties. Let's say that it's could be in cancer, could be in mental health, and other specialties. Then the companion is building effective transportation community to community that really fits the needs of that community, so they can have better access to health care and still stay close to home.
Now, I know that Tahoe Forest is involved in a pilot program for senior citizens. We'll see how that works, but that's a transportation system not unlike Dial-A-Ride near more urban areas, to enable seniors to transport themselves to their appointments without driving themselves.
Right.
And that's a big challenge in almost all rural environments.
I do foresee potentially that multiple rural hospitals might partner together to actually develop as a parallel to what you just shared, transportation systems too, so that their residents can get this better health care. So I think we're all open to that, how we can make health care more rapid and more comprehensive even in these rural areas.
So if rural hospitals began to work in a more collaborative, cooperative, if you will, manner, tell me how the care access would improve, and what does that mean to the patient? It sounds to me like it would open the patient up to second opinions through telehealth and all kinds of other advantages that didn't used to exist.
It certainly opens them up to second opinions. It also, the more we collaborate, even if we were to go so far to share clinical personnel, should there be a disruption or a loss of those personnel in that community, they could get that great care in their community without having to leave their community. So that is the ultimate of sharing, is even sharing your personnel potentially directly in those communities.
Well, and I would think sharing of personnel would maybe be a benefit, maybe even to recruitment in the future, because the net is cast further. You've been watching Mountain Health Today. I've had a conversation with Harry Weiss on the delivery of health care in a rural environment, and we'll be back in just a moment. Welcome back to Mountain Health Today. I'm Ted Owens, your host. Thank you for joining us. It's been a very interesting discussion with Harry Weiss, the Chief Executive Officer of Tahoe Forest Health System. Harry, thank you very much for taking the time to be with us today.
Thank you. It's been a real privilege.
Really enjoyed it. Ladies and gentlemen, please join us again for the next episode of Mountain Health Today. I'm Ted Owens, and thank you for joining us.